Hello, my name's Andy Ashworth. I'm a GP in Scotland and I've made this video for colleagues to actually show a very simple test that can be done in the surgery while the patient is sitting instead of a Dix-Hallpike test. It's quicker, doesn't involve going to the couch. If it's positive, we still need to go to the couch to carry out an epley, but at least this tells us which epley we should be using. First of all, I explain to the patient that what's happened is that it's affecting one of their semicircular canals in their ear. I explain that the ones that tend to be affected are the posterior semicircular canals. Because of their anatomy, they don't drain very easily. There are two, and they're set at 45 degrees in respect of the main axis of the head. So I show the patient in this way with my hands. I then ask the patient, while showing them with my hands what I'm going to do, obviously they don't need to use their hands, I ask them to turn 45 degrees towards the side I'm testing. In this case I'm going to test the left, and I put the left semicircular canal into the line of the movement that's going to occur while negating any movement in the other semicircular canal. I ask the patient simply to bow to 90 degrees and then quickly rise so that we're actually making movement on that left side. Now, I'm not very good at spotting nystagmus, so I simply ask the patient, as we can do in general practice, whether they felt dizzy or not. I then test the other side in the same way. Now, obviously, this is a test only to be used where it's appropriate and where an epley manoeuvre might be effective. That's when vertigo is intermittent and short-lived, and particularly where it's brought on by specific head movements. The beauty of this test now is that I now know which epley to do. It's simple, don't need to do another Dix-Hallpike. One warning I do have is that if I find on both sides that the test is positive, I revisit my diagnosis and go back to the history, because that rather confuses me, and I do like to be absolutely clear that I'm not missing anything significant.